Right, this is assignment 2 for physiology, and we're looking at the long-term or chronic responses to exercise. Okay, so the criteria is here, P3, P4 and M2. So describe the long-term effects of exercise on the musculoskeletal and energy system, and then we describe the long-term effects of exercise on the cardiovascular and respiratory system. Finally, we should then explain the long-term effects of exercise on the musculoskeletal, cardiovascular and respiratory and energy systems. If we go inside, it should make it clearer. So in the first part of your presentation, what you should do is you should describe each one of these bullet points. So you'll see these bullet points, each one of them should be described. So you should describe hypertrophy within the muscular system. What is it? Now, if you want to go for the merit, okay, so where it says here, in addition, you need to explain the athlete's long-term adaptations of exercise on the muscular system and energy system. When explaining, consider the following points: why these adaptations take place within the body, how these adaptations take place within the body. So what you should do is say what hypertrophy is, why hypertrophy takes place within the system, how it takes place, and then give some scientific reasons as to why it takes place. Okay, you do that with each and every bullet point as a pair. Okay, you're then going to, in the second part, look at these, exactly the same principle. You're going to look at the cardiovascular and respiratory system. These are each of the bullet points you need to cover, and you describe what cardiac hypertrophy is, and then you then explain it. So, why does cardiac hypertrophy take place in the system? How does it take place within the body, and then give scientific reasons why. So I'll give you an example. So cardiac hypertrophy takes place in the system because you put the heart under increased pressure. The wall of the left ventricle increases with size, so it goes through a process called hypertrophy where the muscle becomes thicker, and the reason why is because your heart's becoming more efficient, and it has to become more efficient because of the demands that you've placed on it. So therefore the wall becomes thicker and it's able to pump more blood per beat at a more forceful rate. That in turn has lots of impacts on some of these things here, which you should talk about later. Okay, so that's kind of how the assignment's structured. You can't go far wrong if you just stick to the bullet points and make sure you cover each bullet point. What I suggest you do if you're doing a presentation in a pair is do a slide for the muscular system and have each of these bullet points on there, a slide for the skeletal system and a slide for the energy system, and then I would have one slide for the cardiovascular system and one slide for the respiratory system. If you feel like there's too many bullet points for some of the bigger ones like the cardiovascular and the muscular system, then maybe you want 2 slides for those. Remember, if you want the merit, you have to explain why that adaptation occurs in the body. Okay, so it's okay describing it, that gets you the pass, but if you want the merit, then you have to describe it. Okay.